So my name is Jennifer. I'm a physical therapist here at the Acute Rehab. I have a specialty certification in the treatment of patients with neurologic conditions, and my specific interest is in patients after stroke and their recovery. What I tell people is that in the first 2 weeks is where you're going to see the quickest recovery, what we call spontaneous recovery, and that's kind of mediated by your brain healing. When you have a stroke, there's a lot of swelling going on, inflammatory processes that your brain works hard to clear out. And then as that swelling decreases, you can get some things that change overnight. So some patients may go to bed and they wake up in the morning and they're like, oh, I can move my hand again. And this early period, it's crucial to get patients over into rehab, because in the next 3 months after stroke is where you get kind of rehab-mediated spontaneous recovery. So when you have a stroke, there is a part of your brain that does die, but if we can bring you into rehab and get your brain just pay attention to that area that's affected. So let's say my left arm is affected. Sometimes the brain can kind of forget that you have that left arm. So in rehab, we direct your attention to that left arm. We do a lot of activities to strengthen that, to draw attention to that, to improve your brain's ability to control that arm again. That's why it's important to get patients over into rehab right away. It's in that 3-month period where we're going to see the best, quickest recovery. After 3 months, it's not to say that you can't get anything more back. It just tends to be a little bit slower after that. But once you hit that 3-month mark, you can continue to work on improving, reintegrating yourself back into life, building on the strengths and the recovery that you gained while you were in rehab. So if you have other questions, you can contact here at Acute Rehab, and I'm always willing to answer any questions. I do admissions here too, so I can answer any questions and guide you in the next steps. Absolutely, we can make you better. As long as you're willing to do the work, you're going to get improvement by moving. Move to improve overall. Use it or lose it, definitely.